Medical news from MedRxiv. Genetic counseling educational videos significantly improve access to genetic testing and counseling for inpatients with cardiovascular disease. A recent study has found that using genetic counseling educational videos can significantly improve access to genetic testing and counseling for hospitalized patients with cardiovascular disease, a crucial step in informing medical management and potentially saving lives. This breakthrough matters because genetic testing for inherited cardiovascular conditions is a recommended practice by multiple national guidelines, yet access to genetic counseling and testing is often limited, particularly in the inpatient setting. The lack of access to genetic counselors has been cited by cardiologists as a major reason for not pursuing genetic testing, highlighting the need for innovative solutions to bridge this gap. The burden of cardiovascular disease is substantial, with many patients having a genetic predisposition to conditions such as hypertrophic cardiomyopathy or long QT syndrome, which can lead to sudden cardiac death if left undiagnosed and untreated. Despite the importance of genetic testing in these cases, previous studies have shown that it is often underutilized, particularly in the inpatient setting, due to a range of barriers including limited access to genetic counselors and lack of patient awareness. This knowledge gap has hindered the ability of healthcare providers to provide personalized care to patients with inherited cardiovascular conditions, underscoring the need for studies like this one to explore new ways of increasing access to genetic testing and counseling. This study employed a novel approach by implementing genetic test education videos in the inpatient setting, with the goal of increasing patient access to genetic counseling and testing. The study involved a specific population of hospitalized patients with cardiovascular disease, who were shown educational videos about genetic testing and counseling as part of their care. The methodology involved assessing patient knowledge and attitudes towards genetic testing before and after viewing the videos, as well as tracking the number of patients who pursued genetic testing and counseling. The videos were designed to provide patients with a clear understanding of the benefits and limitations of genetic testing, as well as the process of genetic counseling, and were shown to patients during their hospital stay. The results of the study were striking, with a significant increase in the number of patients who pursued genetic testing and counseling after viewing the educational videos. Specifically, the study found that patients who viewed the videos were more likely to undergo genetic testing, with a significant increase in test uptake compared to those who did not view the videos. The effect size was substantial, with a notable increase in patient engagement and awareness of genetic testing and counseling. The study also reported high patient satisfaction rates with the video-based education, suggesting that this approach is not only effective but also acceptable to patients. In addition to the primary findings, the study also explored subgroup analyses, including the impact of the videos on patients with different levels of health literacy and those with varying degrees of cardiovascular disease severity. The results suggested that the videos were effective across a range of patient subgroups, although further research is needed to fully explore these findings. The clinical significance of this study is substantial, as it suggests that genetic counseling educational videos can be a valuable tool in increasing access to genetic testing and counseling for hospitalized patients with cardiovascular disease, potentially leading to better health outcomes and more personalized care. The findings of this study have important implications for clinical practice, as they suggest that genetic counseling educational videos can be a useful adjunct to traditional genetic counseling services, particularly in settings where access to genetic counselors is limited. By providing patients with clear and concise information about genetic testing and counseling, these videos can help empower patients to make informed decisions about their care, and may ultimately lead to increased uptake of genetic testing and counseling. However, the study's limitations, including its reliance on a specific patient population and setting, must be taken into account when interpreting the results, and further research is needed to fully explore the potential of genetic counseling educational videos in the inpatient setting. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.